Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. Most, if not all too often, the loss of smell and taste get overlooked by physicians during chemotherapeutic management because it is not considered a life-threatening side effect of chemotherapy medications. But ponder this question. Taste perception activates neuronal pathways from the brain to stimulate the process of digestion, absorption, and storage of the nutrients the food provides. How is that not a vital and significant component to your overall health? Will this not affect the patient's quality of life, their appetite, their body weight, not to mention their overall moral and psychological well-being? I want this podcast to reach as many listeners as possible, so that the conversation my guest Ashley and I will be having on this topic will bring awareness to these critical and possibly life-threatening side effects to cancer patients and their family members, as well as everyone else who's listening, so that cancer patients can fight their battle with cancer at their best. I have a very special guest here with me today to have a deep dive into the heavy topic we're about to get into on chemotherapy and altered taste, and why this is a highly relevant issue that is affecting so many lives today. Miss Ashley White has a PhD in microbiology and immunology, and I'm so excited to pick her well-educated, intellectual brain today. So let's get started and get chatting.
Hi, Sarah. Thank you so much again for having me on today to discuss, this really heavy but also very vital topic with you. I know you and I both feel very close to this topic, having had people close to us that have had cancer and have received chemotherapy. And I'm sure a lot of our listeners can relate to this topic as well.
Absolutely. And that's why I wanted to have you on today as a guest, because I wanted to pick your brain, and I really want us to just dive deep into this because, I'm coming at it from an oral healthcare professional. You're coming at it from a different perspective as a microbiologist and immunologist. And I'm hoping that we're going to bridge that gap today between oral and systemic health. So here we go. You ready?
Yeah, let's get right into it.
We have a chemosensory system that's in our body. Today, we will specifically talk about and focus mainly on the gustatory and olfactory function that's within this complex chemosensory system. We will also discuss how chemotherapeutic drugs used to treat all forms of cancer may affect these functions within this chemosensory system. First, let's address to our listeners what cancer is. Cancer is a multifactorial process that may be caused from physical, thermal, chemical, or infectious stimuli that alters the integrity of cells both structurally and functionally. This process prevents tumor suppressor cells from functioning normally. Inflammation that resides in the tumor microenvironment may lead to the progression of cancer. So, Ashley, can you tell myself and our listeners what exactly is the chemosensory system and how it factors in on the perception of taste and smell? Go ahead, Doc.
Sure, of course. So the chemosensory system actually involves two complexes, which are the gustatory complex, which controls our sense of taste, and then the olfactory complex, which controls our sense of smell. Now, both of these complexes are actually really closely aligned because they actually share the same chemical receptors within this chemosensory system.
So a lot of times, you think about when someone gets a cold, right? A lot of times they're like, I can't taste or smell.
Right.
That's why,
yes.
Right? Because they're so closely aligned.
Yes, it's all happening together to make those symptoms occur.
Makes sense.
So The olfactory complex is actually located in the temporal lobe of the brain.
Okay.
And the olfactory receptors are actually stimulated through the mucous membrane lining located in your nasal cavity.
Wow.
So from there, the nerve fibers then relay those signals all the way to the brain. Now, the gustatory complex is located within a region of your cerebral cortex. So there's actually 3 main cranial nerves that then carry taste simulation that occurs on your tongue and your taste bud receptors, and then also brings that back to the brain. This complex is actually particularly interesting for the purposes of your podcast, Sarah, because the neurological pathway of this complex travels straight to the central nervous system from the oral cavity.
Wow. That was intense.
Right. It really connects them both.
It does. And that to me is why, I remember I used to get a lot of patients that would come in that had cancer, that were undergoing chemotherapeutic treatments as well as radiation. And I would say, how does that affect your oral cavity? And they'd say, nothing tastes good. Things just don't smell good, don't taste good. I didn't understand exactly why. And that's why I love that you're here, because you're bringing that in-depth knowledge in, so that we can really dive deep into this.
Right.
So
Get to the root cause.
Exactly. So the gustatory neurological pathway from the oral cavity to the central nervous system. So now I want to touch on how these signals start within the oral cavity. I'm going to go now. I'm going to nerd out. So taste buds contain taste cells that reside on the tongue and have neurological dendrite connectors, where nerve sensory receptors migrate and stimulate sensory cells. Stimulation of sensory cells branch from the cranial nerves via the facial nerve, the glossopharyngeal nerve, and the vagus nerve. Cranial nerves that I had just mentioned, the facial nerve, the glossopharyngeal nerve, as well as the vagus nerve, further stimulate nerve signaling receptor cells to areas of the brain, specifically the pons and the medulla oblongata. From the medulla oblongata and pons, taste cells migrate up to the thalamus, where this stimulates the gustatory cortex. So the gustatory cortex contains over 10,000 taste buds, each one containing special receptor stimuli sensory cells. Each taste bud has receptors that are attached to the base of the cell that's connected and exposed to the oral cavity via the papilla of the tongue, the palate, the epiglottis, as well as the pharynx. I know that is heavy, guys, so bear with us. Taste receptor cells are found in the upper surface of specialized cells. Thousands of taste buds are found in structures called papillae on the upper surface of the tongue. So I remember learning in dental hygiene school, the anatomy of obviously the whole oral cavity. So I remember these filiform papillae. They're located on all areas of the tongue, but they actually do not contain taste buds.
Oh, wow.
Yeah, so there's a couple other papillae. So there's fungiform papillae, which are found on the lateral or side borders of the tongue, and these do contain taste buds.
Okay, and they don't contain fungi.
Right.
Okay, so don't get confused,
I know.
everybody. Not fungi in that sense.
Thank you. Thanks for clearing that up. And then there's a folate papillae, which is on the back and the side of the tongue, which also contains taste buds. And then there's one more, and it's called the circumvallate papillae. And they lie on the most posterior portion or back of the tongue, and these also do contain taste buds. There is this taste-stimulating protein called tastin that when it dissolves in saliva actually excites the gustatory gland and generates one of the taste receptor responses, which is something sweet, something salty, savory. There's a fancy word for it called umami. There's bitterness or sourness. So it all depends whatever taste you're receiving, whichever taste bud's going to be stimulated with one of those.
Okay, that makes
tastes.
sense.
Yeah. So someone who is suffering from dry mouth may have an altered taste due to salivary dysfunction. And I just wanted to touch on this for a second because tastin stimulating proteins will decrease in correlation to a decreased salivary flow. Therefore, the sense of taste is impaired, altered, or lost. Because if your salivary flow goes down and you still have those tastin specialized taste bud cells, remember they get stimulated through saliva. So if you have a low salivary flow or dry mouth, that can also alter your taste.
Okay, so it can change the signals that the taste buds are actually going to receive.
Yes, because the saliva actually starts the stimulation process of those taste and taste.
Man, saliva, what can it not do? I know
I'm
you've
telling
talked about
you,
this
man.
before.
I'm going to do a whole podcast of just saliva and all its awesomeness.
The magic of saliva.
Everyone will be like, what is this girl talking about?
Right.
So, all right, Ashley, let me ask you a question. How do chemotherapy drugs relate to altered taste? And how do they affect the health of someone who has cancer or is undergoing treatment?
Okay, yeah, that's a good question. As some of you might already know, so chemotherapy is the treatment of cancers or disease by the use of actual chemical substances. This is especially done through the treatment with cytotoxic drugs. So those cytotoxic chemotherapy drugs, they actually function by permeating through the cell wall of the cancer cells, and they're able to attack them and then effectively kill the cells, which then will prevent them from further metastasizing. So this is all, good and great.
Sure.
However, the cytotoxic effects can also destroy normal, healthy cells. Some of those are hair, skin, our nails, and oral mucosa tissue, as well as weaken the enamel remineralization process and may generate sensitivity in the oral cavity because of it.
Right. And like I had mentioned before, that a lot of my patients that were undergoing chemotherapy or radiation would come in and they would have dry mouth or loss of taste, but also, too, they had a lot of them, especially if they had head or neck cancer, where they had a lot more, radiation to that area and chemotherapy focused to that point. I had a lot of patients that would come in and just say their teeth were so sensitive because your enamel is also regenerating constantly. So unfortunately, it does weaken the enamel as well. It really can affect the oral cavity significantly.
Yeah, it seems like it does.
Yeah. So, all right, let me ask you another question, Ashley. I'm going to pick your brain. So, Ashley, how is it that some chemotherapy drugs that cross the blood-brain barrier may create dysfunction, dysregulation of the chemosensory system and affect taste and smell? Like in my research, I did read that not all chemotherapeutic drugs do cross the blood-brain barrier,
yes,
but some
that is
do.
Correct. Yeah.
So some do, and unfortunately, that's where it does really affect the central nervous system, right?
Right. Yeah, so this is a really critical topic because, as you said, there are some chemotherapy drugs that can actually have the ability to weaken that blood-brain barrier, and this causes that barrier to then increase in permeability. So what that means is the drug components are then able to effectively cross it. Now, sometimes this is done intentionally when treating, brain cancers or brain tumors.
Right.
We want the drugs to cross the blood-brain barrier because those tumors are protected behind it.
Right.
And that's really the only way to get to them during those circumstances. Now, other times there may be unintentional crossing of medications, which we don't want to cross the blood-brain barrier. Now, once the drugs have successfully crossed this barrier, they now have access to the cells within our central nervous system, where they may then have toxic effects on those existing cancer cells.
Right.
But they're also going to have toxic effects on healthy cells that are present.
Right.
And this can actually lead to impacting the sense of taste and smell because the chemosensory system is located in the central nervous system. So damage to the cells of the chemosensory system is then going to lead to dysfunction of the olfactory and the gustatory complexes, resulting in that altered smell and altered taste. And, there's actually a term for this clinically. It's called dysgeusia.
Okay.
So,
yep, I know all about that.
Yeah, so dysgeusia, for our listeners, it actually describes an impairment or malfunction of the gustatory sense, which alters the taste of our food. There's actually many people that are suffering from dysgeusia. They actually state that there's an unpleasant or altered taste, and sometimes they even describe it as metallic in nature.
Yeah, like I remember I've had patients come in and say it's almost like a sour bitter.
Yeah.
Yeah, like metallic. They can't quite put their finger on if it's like a metal or a bitter or sour taste.
Something bitter.
Yeah.
Now, Sarah, you were a practicing dental hygienist. I imagine you can speak to the side effects that your patients have encountered from this type of dysfunction in the oral cavity.
Well, yes, I can. Thank you. So, some side effects from gustatory malfunction or dysfunction in the oral mucosa. So, what I have seen clinically within my patients is one being oral mucositis. This is when your mouth is sore and inflamed. It's a common side effect of chemotherapy and radiation. Although mucositis is usually painful, it can be treated. It should get better within a few weeks of finishing your cancer treatment. A lot of my patients had said they've had mouth burns, from hot foods and beverages. And this burns the papilla. Remember we discussed about the papilla earlier,
Right.
where those taste buds are? So this burns the papilla located on the tongue that contains those taste receptor cells, which can alter temporary loss of taste until the papilla regenerates. They complain a lot of times of highly acidic foods and beverages, like they just can't drink like lemon water or even coffee or eat like red sauce and things like that.
Okay,
It's just
so it irritates them.
It irritates
Okay.
them. And again, the metallic taste from restorative material in their mouths, used for fillings and prosthesis, like people who have partials or crowns with porcelain and metal undercoat. So a lot of times they think that a lot of that metallic taste might be coming from some of that metal that they have in their mouth. But that is a contributing factor to that, but it really is coming from the central nervous system.
Okay, so their senses are kind of heightened for that
Yes.
metallic,
Yes.
those metallic components that are already within their oral cavity. They're getting just like an extensive
I look at it-
signal from that taste.
Right, and I look at it as it's almost that they're hypersensitive.
Okay, yeah.
To the altered taste or anything that they put in their mouth. It's just nothing tastes right, nothing feels right. And it's unfortunate because it's uncomfortable for them. Local anesthesia, I know that they don't tolerate that as well either. A lot of times they'll have salivary dysfunction, as we had mentioned before, where they have a low salivary flow. A lot of my patients that have had chemotherapy, radiation treatment, say that their mouth is just so dry. And also a contributing factor to that is not only the cytotoxic drugs, but also maybe some other medications that they're on as well, because medications are a huge contributing factor for dry mouth. Periodontal disease is another one. When you have cancer, you're immunosuppressed. You know this. And you do have an increase with inflammation sometimes. And a lot of times you can have an increased inflammatory response in your oral cavity, which unfortunately can lead to periodontal disease. You can also have acute or chronic infections, such as abscessed teeth or draining fistulas. So unfortunately, it can be a trickle-down effect from that chemotherapy treatment.
Wow, it does not sound pleasant.
It doesn't. No. And it's sad because, they don't feel well either, and when you don't feel well, unfortunately, it's sad too because they can't enjoy food.
Right.
So I just feel like to me, that's very sad.
So, I mean, how do these individuals really, endure these brutal changes? Like, is there anything they can do to help that or
Orally,
like lessen those side effects?
Yeah. So, for me, what I would recommend a lot to my patients was, if you're going to chew some gum, a lot of times if you chew gum, sugar-free gum, here I go, sugar-free gum.
Sugar-free.
Sugar-free, of course, everybody, coming from a dental hygienist and a doctor here, sugar-free. So I always recommend, pop a piece of sugar-free gum or sugar-free mints that contain xylitol. And the reason why I say that contains xylitol, because xylitol is a natural derivative of sugar. It's diabetic friendly, but it's also a natural antimicrobial, so it will actually help not only stimulate your salivary flow from chewing the gum, but it will also help reduce plaque and inflammation in your mouth as well. Another great one, come on guys, I say this every podcast, brush your teeth after meals. Stay away from products that contain sodium lauryl sulfate. Sodium lauryl sulfate is very common in a lot of toothpaste and a lot of products, and it may increase a burning sensation in your oral cavity that we call in the dental field tissue sloughing. So a lot of times if you are trying a new toothpaste and you brush your teeth and you're like, wow, that burns, that must mean it's really working. Not necessarily.
Not a good thing.
No. I think a lot of people think, well, that fresh burning feeling, like I just feel so clean. Well, that's great, but it's also burning your tissue. So I highly recommend using a sodium lauryl sulfate free toothpaste. something more like a sensitivity toothpaste, I
Okay.
would prefer. Maintain proper oral hygiene by brushing, flossing, using a tongue scraper. Be gentle when you use a tongue scraper, guys, because remember, you already have all those papilla on your tongue. You don't want to push too hard, but just enough to get that plaque off. You really want to keep your mouth as healthy as possible. Experiment with different foods and spices and seasonings, but really, and I'm going to advocate for this, try and stay away from adding like tons of fats and oils and things like that, or over salting or over sugaring foods. But, try some different spices and things like that, and maybe it'll help stimulate some of those taste buds. Use non-metallic dishes and utensils and cookware, especially if you get that metallic taste. Stay hydrated, preferably water, and make water your go-to choice. I always say that, go to water if you're thirsty.
I know. I need to drink more water. I try to remind myself all day long with the water bottle, remember to drink. Sometimes you get so busy, you forget.
You do. I force myself every couple of minutes, go, take a sip,
It's
right?
important.
It is. The one big thing that I want to say as well, avoid smoking cigarettes and drinking alcohol, especially during chemotherapy and radiation.
Okay.
Alcohol is very drying to your mouth, and smoking is a carcinogen.
Yeah.
We don't want to increase our risks, but I had to put that in there. Really, guys, take care of yourselves as best you can. Use oral rinses that can reduce metallic and altered taste for you. Dry mouth rinses and sprays, salivary substitute sprays and rinses may aid in reducing dysgeusia significantly and may increase the taste-in. Remember, the taste-in is those taste-stimulating proteins. And then the last one, what I usually recommend is rinse your mouth with an antimicrobial oral rinse prior to eating. So this may decrease metallic taste, and it may stabilize pH in your oral cavity. And it actually may help when you do go sit down to eat, that you have some stimulated taste buds in there, and it might help increase the sense of taste.
Wow. Okay, that's good to know. I did not know that.
As Ashley and I have shared, chemotherapy patients typically experience metallic taste symptoms. These metallic taste symptoms may pose a larger problem for overall health and nutrition. Getting rid of this metallic taste may seem difficult if you are undergoing any type of cancer treatment. I would like to share with you all an oral rinse called Metakill. Metakill gently alleviates the symptoms of taste disorders. Metakill has a very mild flavor and does not burn the mouth like a typical mouthwash. Metakill is the only product on the market designed for metallic taste relief. If you're interested in learning more about Metakill, visit Metakill.com and you can use coupon code PODCAST30 for 30% off your order. That is PODCAST30 at Metakill.com, and you can find the link in our description. Okay, so let's focus a bit on how cancer, as well as cancer treatment therapy, may weaken the body's immune system. So we talked a lot about, the side effects of what chemotherapy can do to your oral cavity. So let's talk a little bit, Ashley. I'm going to pick your brain about how it affects the body's immune system.
Yeah, so the immune system is really our body's way of maintaining our health, right? It's fighting off any foreign cells that are going to cause infection and disease. Some of these cells of the immune system can actually recognize cancer cells as being abnormal and be able to effectively kill them. But this usually is not enough to get rid of a cancer altogether.
Right.
And this is because cancer progresses, right? Your immune system is going to become increasingly weakened. Mm-hmm. And one of the major ways that cancer can actually weaken the immune system is by spreading to the bone marrow.
Wow.
The bone marrow is actually where our blood cells are produced that are going to eventually help fight infection. This happens most often when you have somebody suffering with leukemia or lymphoma, but it can also happen in other cancers too. And the cancer can actually stop the bone marrow from producing the appropriate amount of these blood cells that are required by our bodies. And additionally, there are certain cancer treatments that can also temporarily weaken the immune system. And this is because they're doing the same thing. They're going to cause a drop in the number of blood cells produced in the bone marrow. The cancer treatments that are more likely to produce this weakening of the immune system are going to be those targeted cancer drugs, radiotherapy, any high dose of steroid, and then, of course, we know chemotherapy. As a result of having this weakened immune system, cancer patients are going to be more susceptible to infection and disease. And additionally, they're going to be more likely, like we mentioned earlier, to experience persistent inflammation.
Right. When I talk and focus more mainly on the oral cavity and how it increases inflammation, it can also increase systemically as well.
Yeah,
right.
Exactly.
So these cancer patients are already immunosuppressed from the cancer. Then the cytotoxic drugs may further immunosuppress the system because it's also attacking healthy normal cells. So they have body aches due to inflammation. Then you add the fact that food does not taste or smell good, and the patient's quality of life is further declined due to malnutrition, further weakening the body. To me, it's that trickle down, that kind of snowball effect, and that's where I struggle. You know, I want to find ways that we can actually help patients increase their immune system, especially during these therapy treatments.
Exactly. And what this can do then is put those patients at risk for actually developing a condition called cachexia. And what this means is that it's actually a weakening and wasting away of your body tissue during that severe ill health.
Right.
And specifically, cancer-associated cachexia is really a disorder that's characterized by the loss of body weight with specific loss of skeletal muscle and adipose tissue, so the fat in the body.
Right.
And cachexia is driven actually by a variable combination of, like you said, reduced food intake. You have metabolic changes occurring, including elevated energy expenditure that's happening, excess catabolism, and also pro-inflammatory responses that are happening within the body.
Right. And, you know, that's why I wanted to address, oral health. I wanted people to understand in depth, what cancer treatment therapies can actually do to the system. And we understand that these patients who do have cancer need this form of treatment. And what we're doing is just trying to bring some light to possible tips and tools that they can use in conjunction to their chemotherapeutic treatment to increase their health.
Right. Yeah, it needs to be incorporated.
Absolutely. So I did a little research and, give me your thoughts on this as well, too. So I had found that some nutritional supplement tips for cancer patients that are undergoing chemotherapy. So one that they were big on was patients taking probiotics. So probiotics, by their properties, may help strengthen the homeostasis and thus reduce side effects associated with cancer treatment. Experimental evidence suggests that probiotics might have beneficial effect on the toxicity of anti-cancer therapy.
Okay, that makes sense. Yeah, I would support that. So you have probiotics.
Thank you.
So adding those healthy microorganisms back into the system.
Right.
Trying to alleviate any dysregulation or dysfunction that you're having within the most exciting thing in, the news today is the microbiome.
Right.
So the microbiome of our body. So that's all of the microorganisms that are actually helping our body to function.
Sure.
I know sometimes we often think, microorganisms, they're all bad, all pathogens. No. That is untrue.
Clarify that, girl.
Yeah,
go, girl. Here she goes.
Both exist, okay? There are pathogens out there that, make us ill and make us sick and want to hurt our bodies. But we also have a whole microbiome within our bodies of those microorganisms that are doing good.
Yeah.
Helping us break down our food, helping us retain our nutrients, all sorts of good
Sustaining
things.
our homeostasis.
Exactly.
We need them.
Exactly.
Props to our healthy microbiota.
So yeah,
Did I say that right?
Yeah, yeah, that's fine. I think that probiotics are probably a good bet.
I agree. And then another one that I did that I noticed this kept coming up during my research, and it was zinc deficiency is very common in those who are undergoing chemotherapy treatment. Zinc deficiencies can lead to serious oral issues like loss of sensation on the tongue, loss of taste, dry mouth, and increased susceptibility to oral diseases. However, as important as it is to have enough zinc in your body, it is equally important not to have excess amounts of zinc. Too much of anything, and I do say this on most of my podcasts, too much of anything in excess is not good.
Right.
So, we need to have some balance here, and it's always important to seek professional advice from your physicians prior to doing any new kind of treatment or trying a new supplement, things like that. However, we're just trying to bring to the forefront the table what we have learned during our
Right.
research, what you have learned, as a doctor. So, we're just trying to raise awareness. Here I go, which I usually always touch on foods at some point when I talk about.
Okay,
I love
you're going to
food.
make us hungry, but
I
all
love
right.
food. I mean, so
Yes.
it's like,
Food is great.
and I do really love to know what kind of foods are really helpful for our immune system. So I actually found that there's some great anti-inflammatory foods to eat during cancer treatment. Tomatoes,
Okay.
they
I
say.
do like tomatoes. I could do that.
Yeah, olive oil. I think olive oil across the board, everybody should
Yeah,
use olive oil.
I can't even remember the last time I ever used like canola oil or
Right.
vegetable oil.
Right.
I've been using
Olive oil. Yep.
since forever.
Yes. Green leafy vegetables such as spinach, kale, collards, nuts like almonds and walnuts, fatty fishes with high omegas. We know salmon
Okay.
is one of those.
See, I don't like fish, but I think they have, the fish oils that
Yes.
you can take,
Yep.
so that should help as well.
Yes, fruits. They say especially fruits that are berries.
Okay.
High in antioxidants.
Antioxidants, rather.
Yep. Turmeric to reduce inflammation. Turmeric is a great anti-inflammatory. In fact, I drink turmeric powder every day.
Do you really? Okay.
Yeah, I'm one of those. I've been running for like 30 years, and it's like, you feel it in your joints a little bit, and I don't want to rely on, anti-inflammatory, so it's like, okay, let me drink this. And I've been doing that for about a year.
Yeah, that's great.
Why not? Ginger, they say, is great for anti-nausea and upset stomach.
Okay,
Ginger.
yeah, that makes sense.
Right. So guys, let's try like fresh ginger. Let's not jump to ginger ale.
Not ginger ale, not that soda
I
with
know,
all that extra sugar.
Right. Cinnamon, they say, is great as well. And my absolute favorite, garlic, and lots of it. Love garlic.
Garlic is good.
Garlic is a great anti-inflammatory. So mainly try to follow the Mediterranean diet because that is a great anti-inflammatory diet. Great for your skin too.
I was going to say, it sounded like you were describing slowly the Mediterranean diet.
Yes. So the other thing that I want to discuss before we close, and Ashley, I know you agree with this, my major thing, especially undergoing cancer, if you have cancer or a loved one that has cancer or you are undergoing chemotherapy or radiation treatment, self-care. It is all about radical self-care, and I mean radical. Nurture yourself and make sure you are surrounding yourself with those who nurture you as well. If you or someone you love is going through treatment, take care. Take care of yourself and take care of your body with practices that will reduce inflammation and enhance your treatment and recovery.
Exactly, Sarah. I could not have said that better myself. You have to be kind to yourself as well, right?
Yes.
Under those kinds of circumstances, a great deal of stress is going to be generated too.
Sure.
Amongst the individuals suffering with the cancer as well as those that care for them.
Right. And I'm a big proponent anyways. If you're kind to yourself, I'm talking across the board, you're going to be kind to others.
Right. In any situation, really.
Right. So the other thing also is great. I have some great stress reducing lifestyle tips while undergoing chemotherapy treatment. And I did do my research on this, and I found that a lot of research has been done on this to say it's great stress releasers.
Okay.
Obviously, it's the power of the mind, power of positivity. A positive attitude creates an atmosphere of healing and keeps the body in a positive frame of mind. I'm a huge advocate for meditation. Meditation for peace of mind, which will allow you to help and aid in the healing process. It's really going to help kind of calm that stress that goes on in your mind, kind of slows that down a little bit.
Recenter you a little bit. Take
Absolutely.
you back down.
Yoga, real simple stretching is really helpful. It's also good to kind of get your immune system going a little bit, move a little bit, stretch. And surround yourself, again, here I say this, and I'm going to close with this. Surround yourself with positive people as much as possible to maintain low stress and to maintain a positive mindset. Ashley, girl, I want to thank you so much for coming today on the show to address this very serious issue, as well as bring all your amazing knowledge. You are so smart.
Of course. Thank you, Sarah. I was happy to be here, honestly.
Is there anything that you'd like to add before we close the show today?
I think we've I think we've hit everything that we wanted to hit.
I think we nailed it.
I hope listeners out there, I hope you enjoyed and also got educated. Like maybe
Sure.
you learned some things you didn't know before,
Right.
Or maybe because of the things you've learned today, you can have more compassion and patience with maybe some of your relatives that are experiencing these complications.
Absolutely. And I always want to close as well too in saying, us as medical and dental professionals, for us to always have that compassion to what others are going through, because you never
Exactly.
know what people are going through, and to just be, a supportive ear, to even just listen,
Exactly.
and to show compassion, because that can just go for miles.
Right.
I think
it can make all the difference.
It can absolutely make all the difference. So, Ashley, thank you so much for joining me today. This was a great podcast. Thank you for all of my listeners listening. If you like the show, please hit the like button, subscribe. We are a building, growing podcast, and we have so many amazing followers and supporters. And I just want to thank you all from the bottom of my heart. And I hope you all have a lovely weekend. Bye, guys.